So today we are going to talk about this topic, again a very important topic, low birth weight. So can anyone tell me what does low birth weight mean? When less than 2.5 kg is the birth weight is the birth weight of a newborn child. That is termed as low birth weight. So why please I want silence now. I have given you enough time to settle down. I want pin drop silence. So why this topic is important? Why we need to discuss low birth weight in a class? Why? Any? Early diagnose कर सकते हैं. Okay, what else? Anyone? Please no talking. Why we need to, or why is low birth weight important? If the birth weight is less than 2.5 kg as we talked about just now, it is termed as low birth weight. But why it is important? What can low birth weight lead to? It can lead to mortality, okay, and what else? Mortality जैसा ही एक और word होता है morbidity. So it can lead to deaths also, and it can lead to different type of illnesses also. So that is why we need to take care of this low birth weight. So this is the first weight of the fetus or newborn obtained just after birth. And what is the importance of birth weight, whether it is low, normal, or high? It is that it is a single most important determinant for survival, growth, and development of infant. A low birth weight baby will have all his or her milestones delayed. Please no talking. If you want to discuss something else, you can just move out of my class. So that is why it is very important for survival, growth, and development of the infant. And it, besides this, is also reflects the health status of the mother during adolescence and pregnancy and the quality of antenatal care. So it becomes an indicator of antenatal care and the health status of adolescent girls and health status of a pregnant woman. This becomes a very important indicator because if there are more incidents of low birth weight, that just reflects on poor health status, poor antenatal care of mother and adolescent girls. So any infant with a birth weight of less than 2.5 kg within 1 hour of birth, regardless of the gestational age, is termed as low birth weight. So you need to know what the definition says. This is very important because low birth weight is asked in one or the other form in your theory examinations also and in your vivas also. So if we just want to grade it, the low birth weight, if it is ranging from 2.5 to 2.2, 2.0 kg, it is termed as low birth weight. If it is between 2 to 1 kg, it is very low birth weight, and less than 1 kg is an extremely low birth weight. This is the grading of low birth weight starting from 2.5 going up till less than 1 kg. So what is the problem statement? More than 20 million of the infants worldwide, representing 15.5% of total births, are born with low birth weight. So we have quite a high percentage of low birth weight. And as per WHO criteria, in India we have an incidence of 33%, which is too high. It's almost double of the global scenario. And prematurity is the world's single biggest cause of newborn deaths and second leading cause of all child deaths after pneumonia. So as we said, it can lead to a large number of mortality and morbidity. So here you can see India is having a large number of low birth weight babies. Now I had used the term preterm also. So we have two types of low birth weight babies based on the origin, like how they have originated. One is preterm, that is they were born before their term time. So that is why they were growing in the right way, but because they were born before the time, so they were low birth. The other is small for date, or when there is intrauterine growth retardation. That is actually what their development would have been at maybe 37 weeks, was not exactly according to the gestational age. So they are small for their date. Sorry. So under preterm, if they are born less than 37 completed weeks of gestation, and this forms, yes, last row, please stand up. Stand up. Stand up. So as I told you, there are two types. One is preterm, one is small for date. So this preterm category forms about 1/3 of the low birth weight babies, while this small for date or IUGR, this accounts for 2/3 of low birth weight babies among the neonates. Now coming to the causes, as we have divided them into two groups, the preterm babies and the small for date or IUGR babies. So in nearly 50% of the cases of low birth weight, usually the cause is not known. And in the rest of the 50%, they can be grouped into medical and social causes. So what are these medical and social causes? Like the medical causes can again be grouped into three categories: the maternal causes, the placental causes, and the fetal causes. So at one end we have the mother, the fetus, and their connecting link, that is the placenta. So it can be any of these. So maternal causes, all high risk mothers except diabetes. Why? Why we are excluding diabetics over here, diabetic mothers, for low birth weight babies? Any answer? Usually in a diabetic mother, the baby is overweight, not low birth weight. So that is the reason we are saying all high risk mothers except diabetics. Then under placental causes, we have placenta previa, we have congenital defects of placenta which can lead to low birth weight. Then in the fetal causes, there can be multiple gestations, that is multiple pregnancies are there, or hydramnios or intrauterine infection. These can also lead to low birth weight babies. Then coming to the social causes, it is not always that only the medical causes cause a disease. You would have done your clinico-social case studies also in second MBBS. So there also you would have seen that any disease that is occurring is having medical as well as social causes. So under social causes, we have poverty, illiteracy, ignorance, poor standard of living, lack of knowledge on family planning, early marriages, smoking. All these can lead to low birth weight babies. Now coming to the problems that can occur due to low birth weight. First we'll be talking about the problems that can occur in a preterm low birth weight child, and then we'll be talking about small for date babies having low birth weight. So there can be birth asphyxia because the lungs might not be fully developed, so this may lead to birth asphyxia. Hypothermia because they are born before the time, so their thermal regulation system is not properly developed, so that can lead to hypothermia. And all these problems like feeding difficulties because the child has not grown to that age, so there can be feeding difficulties. The child would be more prone to infections. There can be hyperbilirubinemia, respiratory distress, retinopathy of prematurity. Then there can be apneic spells, intraventricular hemorrhages, hypoglycemia, and there can be even metabolic acidosis. While in a small for date baby, there can be birth asphyxia, there can be meconium aspiration syndrome, hypothermia, hypoglycemia, infections, and they can be polycythemia. So you can see there are certain things which are overlapping. The problems are overlapping in both the categories like birth asphyxia, hypothermia, hypoglycemia, and infections. They are common whether a low birth weight baby is due to preterm or whether the baby is a small for date baby. So how we need to take care of these babies? The care depends on the birth weight of the baby. So if the birth weight is 2.5 to 2 kilograms, the baby requires special care at home itself. If the weight is less than 2 kg, they require special care at hospital. And if the weight is between 2 to 1.8 kg and they are stable hemodynamically, they require kangaroo mother care. So we'll be talking about this kangaroo mother care. You get short notes on kangaroo mother care quite frequently. So what we need to take care in special care at home, the principles are we need to prevent infections, we need to prevent hypothermia and correct malnutrition. These were the problems that occur in a low birth weight baby. So we need to take care of these things primarily: prevention of infections, hypothermia and malnutrition. So how will be preventing these infections? By gentle and minimal handling of the child. Handling, if needed, that should be with clean hands. Room must be warm so that we can avoid hypothermia in the child. It should be clean and dust free so that the child doesn't get any infections, and giving the child immunization at the right time. We should not delay the immunization if the child is low birth weight, because in that condition the child needs more of protection. So we need to give him the proper immunization at the right time. Then coming to prevention of hypothermia. So we need to avoid bathing the child till the baby attains at least 2.5 kilogram of weight, because more the smaller, more are the chances of hypothermia. And if we are bathing the child, we are decreasing the temperature of the baby furthermore. So we need to avoid bathing the baby. We can just sponge him and keep him covered. Cover the baby with clean, dry and warm clothes. Bottles filled with warm water and covered with thin cloth, they can be kept on both sides of the baby, or baby without blanket can be kept near a 60 candle bulb which is burning. So at times you would have seen whenever there is a new delivery, you would have seen even in hottest of months, अभी के मंथ में भी अगर आप जाएंगे gynec ward में, obstetric ward में, you will see all the babies, they are covered up because being small, they have area which is giving out heat. So they need to be covered up so that their body temperature is maintained, because their thermal regulation is not working as correctly as ours. They lose body heat very quickly. So we need to cover them even in hottest of months to prevent them from hypothermia. And for a low birth weight baby, it becomes all the more important that we need to conserve all the heat that the baby is having and keep the child covered up. So we need to take care that we prevent hypothermia, because this becomes one of the reasons for mortality of a low birth weight baby. So we have seen either we can cover the baby with clean, dry and warm cloth, or we can keep hot water bottles which are very warm, not very hot, around the baby so that the temperature of the baby is maintained, or we can keep the child near a 60 candle burning bulb. Then the third principle that we needed to take care was correction of malnutrition. So as I told you that a low birth weight baby has difficulty in sucking or feeding. So because they can't suck the milk actively, because their cheeks, their gums, they are not well developed and they get tired very easily, they are not able to feed properly. What can be done is frequent breastfeeding is advised almost every alternate hour, so that howsoever little the child may be able to suckle, if he is getting frequent feeds, that would be good for the child. So we need to keep the baby warm at home. Here you can see the baby is lying on the chest of the mother. We have to prevent heat loss, because all the procedures like conduction, convection, radiation, evaporation, they all occur if the baby is kept all bare. So the baby needs to be kept all covered up, as you can see over here. So you would have always seen that a newborn baby is always snugly wrapped and kept near the mother, so that mother की body heat जो है वो भी baby को warm रखती है. And according to the birth weight, the room temperature also needs to be kept. So if the birth weight is very low, the temperature of the room should be a bit higher, that is 34 to 35 degrees Celsius. If the birth weight ranges from 1.5 to 2, it should be between 32 to 34, 2 to 2.5, 32 to 32, and if it is more than 2.5 kg, then we can keep a temperature of 28 to 30 degrees Celsius. So warm the room with either fire or heater. But in case if we are burning fire, the room should not be closed, because what will happen? It will lead to suffocation. There would be more of carbon monoxide, and that can ultimately lead to death. So this was all about the special care that needed to be provided at home. Now talking about the special care that we can provide at hospital. So for prevention of infection, we can give prophylactic antibiotics to prevent septicemia in the newborn child. Separate nurses for feeding and toilet attending, so that there is no infection. Barrier nursing to prevent cross infection. Barrier nursing is that because in the nursery there are so many children lying, so there needs to be barrier nursing. There should be gap between them so that they don't get cross infections from each other. Then again we need to prevent hypothermia. So how we'll be taking care of hypothermia in hospital premises? We can keep the child under incubator. It maintains the temperature, humidity, and oxygen supply till the weight increases to at least 2 kilograms. Careful monitoring of oxygen supply is needed because either low or high oxygen concentration can lead to various morbidities, like low oxygen can lead to hypoxia and cerebral palsy, while high oxygen concentration can lead to retinopathy of prematurity. So, a very careful monitoring of oxygen supply is needed. Then correction of malnutrition, because the baby is already malnourished, weight is ranging. स्पेशल केयर के लिए हमें स्पेशल केयर एट हॉस्पिटल के लिए वेट रेंज क्या थी? less than 2. So child is already malnourished. So further malnutrition needs to be prevented. So tube feeding can done if the baby is in incubator and it is too young to suck mother's milk. So here you can see the child is being feeded by a tube. Now coming to kangaroo mother care, again a very important topic. It was first suggested by Dr. Edgar Ray in Colombia, and I hope you know and you would have seen pictures of kangaroo. I won't say that you would have seen a live kangaroo, maybe not everyone would have seen that. But what is something special about kangaroo? It has a pouch, and what is there in the pouch? The baby of the kangaroo is there in the pouch. So the baby is lying very near to the mother. So from there only we took this name kangaroo mother care. So it refers to care of preterm or low birth weight infant by placing the infant in skin to skin contact with the mother, or in case if the mother is not there, then it can be any other caregiver. So what we are doing by this? By placing the child in kangaroo mother care, what principles we are following? Yeah, hypothermia. We are trying to correct hypothermia, taking care of hypothermia. What else? क्या क्या 3 चीजें थी? Hypothermia, infections and malnutrition. तो हम hypothermia को take care कर रहे हैं when the child is in contact, skin to skin contact with the mother or the caregiver. Then because वो mother के साथ ही है तो infection के chances baby की handling कम हो गई, तो infections कम रहेंगे. And because the child is in contact with mother, always lying with the mother, there are more chances of frequent feeding, so there would be less chances of malnutrition also. So we are taking care of all the 3 principles, that is hypothermia, taking care of infections and malnutrition by kangaroo mother care. So what are the parameters which need to be monitored during kangaroo mother care? Temperature has to be taken once in every 6 hours. Respiration has to be taken care of, that the child is not apneic. Feeding is to be done once in 90 to 120 minutes, that is 1.5 to 2 hours. We have to monitor the well-being by educating the mother about the danger signs, because if the mother is not knowing what are the danger signs, she won't report that there is something unusual going on. And the growth has to be gain of 15 to 20 gram per kilogram per day. So if the child is 2 kilogram, weighing 2 kilogram, there should be a gain of 30 to 40 gram per day. And compliance with kangaroo care. These all parameters need to be monitored during KMC, that is kangaroo mother care. So what are the components of kangaroo mother care? First of all is the kangaroo position. So here, those who I don't think that you wouldn't have seen a picture of kangaroo, but if you haven't, here I have a picture of kangaroo with the kangaroo's child in the pouch. So As you can see this position, it consists of a frog-like position of the low birth weight newborn baby with skin to skin contact with mother in between her breasts in a vertical position. तो ये जैसे vertical position में है baby, इसी तरह से mother के साथ low birth weight baby की position होगी. So the provider can either be mother, and in extreme condition when there is the death of the mother or the mother is not well, then there can be any other provider also. So the provider must keep herself in a semi-reclining position to avoid gastric reflux in the infant. अगर mother लेट जाएगी तो the child too would be in the supine position. So there can be chances of gastric reflux. So the mother should be in a semi-inclined position so that there is no gastric reflux, and it has to be maintained 24 hours a day till the child gains at least a weight of 2 kilograms. Now, how to prepare for this kangaroo mother care? So baby must be suitably dressed in a cap because we want to maintain his temperature. We don't want the child to lose his or her body heat. So we need to dress the child in a cap. You would have always noted this also, that a newborn baby is always covered on the head because head से भी बहुत सारा heat loss हो जाता है. They usually don't have hairs as thick as we have. So that is also one of the area where the body heat loses very fast. So the child has to be dressed in a cap, soap-proof diaper, because if we are just putting on a normal cloth diaper on the child and he's passing urine, that would make the child more cooler. So we need, if he's passing urine, what will happen? The diaper would be wet and that would lead to loss of heat. So we need to put a soap-proof diaper on the baby, socks and an open shirt to have a skin-to-skin contact between mother and baby, and placed in a kangaroo bag. So what are the mechanism of prevention of hypothermia? A thermal synchrony is maintained, and how it is done? If the temperature of the baby decreases by 1 degree Celsius, there is a correspondingly increase of 2 degrees Celsius temperature of mother to warm up the baby. So this happens itself. What is happening? I am again repeating, I don't want any type of disturbance in my class. I can hear some whispering also again. So this thermal synchrony is being maintained between the baby and the mother. So when there is a decrease of 1 degree Celsius of the baby's baby's temperature, there is a 2 degree Celsius increase in the body temperature of mother, so that the temperature of the duo, that is mother and the baby, is maintained. While if the temperature of the baby raises by 1 degree Celsius, the temperature of the mother decreases by 1 degree Celsius, so that the temperature is maintained. So this was about hypothermia. Next, coming to the feeding policy. So kangaroo position, that is the semi-reclined position of the mother with the baby, is ideal for breastfeeding. Exclusive breastfeeding is the policy that needs to be followed, and feeding has to be done in every 1.5 to 2 hours. If the baby can suckle, the best thing is that let the baby suck, and if the baby is unable to suck or swallow, then we can give expressed breast milk by nasogastric tube. Then coming to the discharge. So the criteria for discharge is weight gain of at least 40 gram a day for 5 consecutive days. As we just calculated in the last slide, कि 15 to 20 gram per kilogram body weight gain होना चाहिए per day. So that comes up to be around 40 gram a day, and this weight gain should be at least for 5 consecutive days. So that makes up for an increase of 200 grams. So if there is a weight gain of at least 200 grams in 5 days, we can discharge the baby. The baby is feeding well on breast milk, temperature is being maintained, no evidence of any illness, and successful in-hospital adaptation of mother and other members of the family. In that case, we can go for a discharge of the mother and the baby. Then comes the follow-up. After we have discharged, what we need to do? After the discharge, this kangaroo mother care for this low birth weight baby has to be continued at home also. It is not so that we can just leave the baby aside now. It has to be followed at home also. And follow-up is done daily by the health worker for a week and ensure that baby is feeding well and gaining about 40 gram weight daily. And after this, once a week follow-up is mandate till the baby reaches 40 weeks of post-conceptional age. Now, what are the benefits of kangaroo mother care? Again, these benefits, they are to all, like to the baby also, to the mother also, family also, to the healthcare system also. So, first of all, talking about the benefits to the baby. So, the baby is kept warm all the 24 hours by the mother. So, she is acting as a natural incubator. Instead of putting the baby into an incubator in the hospital, we are putting the child into a natural incubator. It has minimum risk of apnea. It gains physiological stability. It gets safety and love. Early growth is promoted, and there is a reduced risk of nosocomial infections, because as I told you, there can be cross infections when a child is placed in a nursery. So if the child is with kangaroo mother care, there are less chances of infections also. Now, what are the benefits to the mother? Mother becomes actively involved in taking care of a child. She is relaxed, confident, and empowered that okay, she can take care of a child and the child is all well. Bonding is better established and breastfeeding becomes more successful. What are the benefits of family? This kangaroo mother care, because the mother is acting as an incubator, so this becomes a very economical care as compared to the cost of intensive care. There is better follow-up and it promotes bonding among the family members also. Again, what are the benefits to the hospital and the nation? It is saving materials. हमारी जो economical cost है वो कम हो गई. It is saving materials like incubators and oxygen cylinders, saving manpower in terms of nursing staff. Otherwise, we'll have to employ nursing staff to take care of all those children. Yeah, you stand up, all three. Stand up, last row. And move out. Move out. In spite of telling me again and again, you are continuously talking. Move out. Please move out and don't waste my time. You're wasting all others' time also. Just move out. अभी आप बाहर जाइए. I don't want to see you here. Then coming to the benefits of nation. So, as we talked about that what low birth weight is leading to, more of morbidity and mortality. So here KMC, kangaroo mother care, is reducing neonatal mortality and thus infant mortality. So this KMC can help us a lot in reducing these two indices. And because a low birth weight baby, in the very starting I said, their development is very slow because they are already very small for their development. So If they are not taken care of at the right time, what will happen? Their physical, mental development would be affected. So because their mental development would be also affected, we won't be able to get better individuals for our future. So the benefits are we can get healthy, intelligent children, adding to the nation's health and wealth. And as we said, there are more chances of exclusive breastfeeding when kangaroo mother care is being given. And it is proven that a child who is fed on exclusive breastfeed has better IQ levels as compared to those who are not exclusively breastfed. Now we have talked about all the causes, the controls. Now what about the prevention? So there can be indirect interventions and there can be indirect intervention measures. So under the direct intervention measures we can prevent malnutrition by nutritional education and supplementation under ICDS for especially the pregnant mothers and the adolescent girls who are going to become mothers in the near future. We can prevent anemia by distribution of iron folic acid tablets. We can control the infections because one of the reason for low birth weight was intrauterine infections also. So by early diagnosis and prompt treatment, avoid strenuous exercise, smoking and alcohol among pregnant mothers. This can also lead to low birth weight baby. So again, I would just like to add what was that condition where we won't never get low birth weight baby? A diabetic mother. And smoking is one of the reason of low birth weight baby. Usually if we talk about in higher socioeconomic class, usually they are babies with higher birth weight. Only smoking is the reason which can lead to low birth weight among higher socioeconomic class. Now coming to the indirect interventions, so these are mainly the family welfare services such as deciding age at marriage, because if the age at marriage is too early and the age at first child is too early, there are more chances of low birth weight because the mother is not as yet like having proper nutrition or proper growth so that she can bear a child. Then birth spacing. If the birth spacing is low, that is, there are births occurring every year, then again, because here the mother's nutrition is being compromised and thus it will lead to a compromised birth weight of the newborn child. So there should be at least a birth spacing of 3 years between two births because that gives the time to cover up the nutritional deficiency that has occurred due to pregnancy and childbirth. Deciding the number of children, if there are too many number of children, again the nutritional status and the health of the mother is affected, and improvement of availability of health services to women. Like situations have changed in urban areas, but still in the rural areas, the woman's health is given the least priority. Pregnancy is considered as a very normal physiological change, and people don't go for antenatal care. They don't take care of their nutrition. Although, how much amount of nutrition is required as compared to the normal? In a pregnant mother, should the nutrition remain the same, the dietary needs remain same in the pregnant state, or they should increase? Caloric demands बढ़ जाती हैं because there is one more life that is needing nutrition. So it has to increase around 1.5 to 2 times the normal diet. So that needs to be taken care of, and that is through improvement of availability of health services to women. So with this, I finish the low birth